Addiction, medical issues. I started using K when I was 16 socially at parties, then proceeded to use it with just a few friends. I began by sniffing tiny bumps, finding myself in a state of euphoria, otherwise known as a K-hole. At this point, my tolerance was very low. The sealed vial that contained ketamine came in either a yellow, blue, red, or green label, pure and straight from the vet. Bumps turned into lines and then bigger rails. As my tolerance heightened, some of the mental visions or hallucinations would entail feelings of floating, rising, and sinking. If I were watching TV or a movie, I would actually feel as if I were inside the program, seeing as though I entered into another realm or netherworld literally. I'm assuming I like this because the experience is fantasy dominated unlike any other. Through the years of going through these phases of psychological addiction, I would travel or move away, living my life normally without partying with ketamine. I always associated this drug with people, places, and things, but I must admit it is amazing and I really do enjoy doing it. It's unfortunate that my habit did become serious substance abuse over time. At 22, moving back into the same environment, I remember one evening there not being a microwave to cook the lick of K, and I experimented with a needle into the muscle. To this day, my use escalated to intramuscular injection from 1cc to 2cc at a time, usually 10 to 20cc a day, which equaled 2 full licks a day with the use of a half-inch diabetic insulin needle, either in my butt cheek, which isn't as effective as injecting it into my arm muscle. I was never trained in this field, and I'm certainly not a certified nurse or doctor, so obviously there's a lot wrong with this picture. Thank goodness I never wanted to go into the vein, and I never will. I find that to be one of the worst and most dangerous things I could do to myself. This is all very crazy, of course. The feeling of injection from K is much more intense than sniffing. If I could describe it, I would probably compare it to more sort of a blackout or temporary loss of time. My mind is somewhat cloudy and certain things are enhanced. Slow motion will happen, and I must be very careful to do this in the safety of my own home, never driving on it because vision will be impaired, and never doing it around people I don't know or an unfamiliar place. I could embarrass myself, possibly fall, or get taken advantage of by a complete stranger if not cautious. Also, I could get arrested if caught by the law. Family and friends have had serious concerns for me getting hurt or jeopardizing my health. Thank goodness I never went to the streets to buy any of this stuff, and it always came from someone I knew and felt comfortable with. Otherwise, I wouldn't go out of my way. This may not seem typical of a drug user, but everyone is different. Which brings me to why I am writing this document right now. I'm presently 26 and still do K nearly every day. It seems to be always in the back of my mind at times. By the way, a word of advice. Sometimes the friends you may think are your friends really aren't. They're just out for themselves in the long run, either just to get high or make some money. Money, sex, and drugs are the root of all evil. Medical issues that have occurred, something described as a K pain for me is when my organs feel as if they may be squeezing together, then I see spots, get very hot, either throw up and or pass out for a couple seconds to a minute. Very scary. I wish I would never do it again. I don't want to move. It almost comes in contractions. Comes and goes away for 5 to 10 minutes, then comes back. When I vomit, it is mostly clear bile. This will make me feel a lot better. An antacid such as Zantac, Malox, or a doctor-prescribed pre-vised antacid will help a lot. In this case, I stay away from acidic foods such as tomatoes, orange juice, etc. It will eventually go away and not happen for months, even longer, maybe depending on my usage. Another symptom I recently experienced is a urinary tract infection. This is very uncomfortable burning sensation when I urinate caused from bacteria collected on the walls of your urethra. I'm trying to find out how ketamine can cause this. It is imperative to be extremely aware of symptoms because I don't want anything to spread to my kidneys, possibly my brain, and or any other organs. I am not untouchable in this life, even if I may think I am or want to be. This is not a physically addicting drug, only mental, and if I want to get help or change my lifestyle, I have to want to make a difference badly enough. I don't believe you can be forced into going into rehab. In some cases, I've heard of people going away, spending thousands of dollars, and getting out and putting themselves right back into the same vicious cycle all over again. Hopefully, I will learn from my personal mistakes and grow out of this without having to run away from my problems and face the true reality of the meaning of existence, helping others and eliminating the selfishness that most human beings tend to get caught up in. Temptation and loss of control are key factors that contribute to this whole addiction process. I hope to grow wiser and better myself and my health in due time.